Assalamu alaikum, my name is Jenan and today I'm going to be explaining the muscles and the thigh region. Let's start by looking into the compartments of the thigh region. When it comes to most of the limbs, we have basically a deep fascia surrounding them, and this deep fascia is going to give its derivative, which we call intramuscular septa, dividing it into compartments. When it comes to the thigh, we have three main compartments. We have an anterior, a medial, and a posterior compartment. Every compartment will have its own group of muscles performing a certain function. So, in the medial, lateral, and posterior intramuscular septa, anterior, posterior, and medial compartments. The anterior compartment will be situated between the medial and the lateral intramuscular septa. Then between the medial and the posterior intramuscular septa, we have a medial compartment. And finally, between the posterior and the lateral intramuscular septa, we have the posterior compartment. So as mentioned, every single compartment will have its own group of muscles performing their own functions or their own movements. So the anterior compartment between the medial and the lateral intramuscular septa will mainly flex the thigh at the hip joint, or simply flex the hip, and extend the leg at the knee joint, or extend the knee joint. And they're supplied by the femoral nerve. Regarding the medial compartment, these are a group of muscles that will be supplied by the obturator nerve. They're the muscles situated between the posterior intramuscular septa and the medial intramuscular septa, and their main function is to adduct the thigh at the hip joint. Finally, the posterior compartment, these are muscles situated between the posterior and the lateral intramuscular septa, supplied by the sciatic nerve, and their movements are opposite to that of the anterior compartment. So the anterior compartment is flexing the hip and extending the knee. The posterior compartment is extending the hip and flexing the knee. So let's start by talking about the anterior compartment muscles. Again, anterior compartment is between the medial and lateral intramuscular septa. It has muscles that will flex the hip and muscles that will extend the knee. The flexors of the hip are iliopsoas, which is technically two muscles that has a conjoined tendon inserting into the same place, pectineus and sartorius, and the extensors of the knee joint are a group of four muscles collectively known as quadriceps femoris because they have one tendon or one point of insertion. So that is the anterior compartment muscles. So let's start by looking at the sartorius muscle. The sartorius muscle is the muscle that will be situated or located and forming the lateral border of the femoral triangle. It's coming from the anterior superior iliac spine of the hip bone and inserting onto the anterior aspect of the tibia, medial to the tibial tuberosity. This muscle is actually going to form or going to be part of the pes anserinus muscle, which is basically formed by the sartorius muscle of the anterior compartment. Behind it, we have the gracilis muscle, which is from the medial compartment. And finally, we have semitendinosus, which is from the posterior compartment. The main job of these muscles is to help in initiation of flexion of the knee or unlocking of the knee. So usually the knee, when it's extended, it will be in the locked position. And then to unlock it, we have some muscles that will help by doing the flexion. So some of these muscles that are helping in the flexion are these pes anserinus muscle. So while it is situated into the anterior compartment and it will flex the hip joint, it's also going to help in flexion of the knee joint, even though it's an anterior compartment muscle. So again, coming from the anterior superior iliac spine into the tibia, specifically onto the anterior surface of the tibia, supplied by the femoral nerve, and it will flex both the hip joint and the knee joint. The most important clinical significance of this muscle is that usually when a person is pushing off the ground, when they're sitting on the ground and they push off the ground, this muscle can possibly be pulled or it can be strained. The second muscle is the iliopsoas muscle, and as we said, it is actually two muscles, the psoas major muscle and the iliacus muscle, having a conjoined tendon inserting into the lesser trochanter. The psoas muscle, the psoas major muscle, even though we consider it as the anterior compartment of the thigh, it's actually part of the abdominal muscles because it's coming from the vertebra. It's coming from the transverse processes, from the intervertebral disc and the adjacent bodies of T12 to L5. So since it's not technically an anterior compartment, since it's actually coming from the abdominal region, it's not supplied by the femoral nerve, it's supplied by the anterior rami of L1, L2, and L3. And this muscle will also help in flexion of the hip joint. So similar to all of your anterior compartment muscle, it will flex the hip joint, but it's the difference of it in it's coming from the abdominal region, so it's supplied by the anterior rami of L1, L2, L3. The clinical significance of this muscle is that sometimes an infection can happen in the vertebral bodies or around that region because of a certain microbe like staph or tuberculosis. And this infection, you can have an abscess forming or pus collection forming. And then ultimately, because of the deep fascia and gravity, this abscess can drop down to the femoral triangle. And we can have a protrusion in the femoral triangle because of this abscess and because of this infection. The second muscle that is part of the iliopsoas muscle is the iliacus muscle. The iliacus muscle is going to come from the iliac fossa of the hip joint. So the hip joint will have the ilium, and the ilium has an ala. The anterior ala is referred to as the iliac fossa. And this iliac fossa is where the iliacus muscle is going to originate. And along with the psoas major muscle, it will insert as a conjoint tendon into the lesser trochanter. This muscle will be supplied by the femoral triangle, and it will flex the thigh at the hip joint, or simply flex the hip joint. The last flexor of the thigh region, or flexor of the hip joint, is the pectineus muscle. The pectineus muscle is going to come from the pectineal line, inserting into the posterior aspect of the femur, supplied by the femoral nerve. And while it does flex the hip joint, it can also adduct the hip joint. So far we spoke about sartorius muscle coming from the anterior superior iliac spine and inserting into the anterior tibia, supplied by the femoral nerve, and we said it will both flex the hip joint and flex the knee. Then the iliopsoas muscle, which is the conjoint muscle, or the muscle that is formed by psoas major, coming from the vertebral bodies and the intervertebral disc and the transverse processes of T12 to L5, and supplied by the anterior rami of L1, L2, L3. And then we also have the iliacus muscle, which is coming from the iliac fossa, but supplied by the femoral nerve. They'll have the conjoint tendon inserting to the lesser trochanter, and then causing flexion of the hip joint. And then finally the pectineus muscle, which is coming from the pectineal line of the pubis, inserting into the posterior aspect of the femur, and then supplied by the femoral nerve, and it does do flexion of the hip joint, but it can also adduct. Now the other group of muscles that are going to be situated in the anterior compartment are the muscles that are collectively known as the quadriceps femoris muscle. These quadriceps femoris muscles are formed by 4 muscles, and they're called rectus femoris, vastus medialis, vastus lateralis, and vastus intermedialis. And again, they are extensors of the knee joint. Rectus femoris will have 2 heads. It has a straight head and a reflected head. The straight head is coming from the anterior inferior iliac spine. Anterior superior iliac spine, we have the origin of sartorius. But the anterior inferior, we have the straight head of the rectus femoris. And then a little bit more to the back aspect, we have just above the acetabulum, we have the reflected head of the rectus femoris. So again, rectus femoris has 2 heads. A straight head coming from the anterior inferior iliac spine, and a reflected head coming from, or just superior to, the acetabulum. So this is the most superficial muscle of the quadriceps. If it was reflected, or if it was removed, we would be able to see the other 3 muscles. First of all, in the vastus medialis. Vastus medialis is coming from the intertrochanteric line and the medial lip of linea aspera. So linea aspera is the line on the femur that is on the back aspect, the posterior aspect. So from the medial aspect of it, or the medial lip of linea aspera, we'll have vastus medialis along with the intertrochanteric line. Vastus lateralis will come from the lateral lip of linea aspera with the greater trochanter. So from the intertrochanteric line and the medial lip of linea aspera, we have vastus medialis, whereas vastus lateralis is coming from the greater trochanter and from the lateral lip of linea aspera. The intermediate muscle, vastus intermedius, will come from the shaft, from the shaft itself, from the femoral shaft. So again, we have rectus femoris with its straight and reflected head. Straight head is coming from the anterior inferior iliac spine, and the reflected head is coming superior to the acetabulum. Then we have vastus medialis, which is coming from intertrochanteric line and from the medial lip of linea aspera. From the lateral lip of linea aspera and from the greater trochanter, we have vastus lateralis. And vastus medialis is in the middle, coming from the shaft of the femur. Finally, they will all come and insert in a conjoint tendon to the patella, to the sesamoid bone, via the quadriceps tendon, and it will continue as the patellar tendon into the tibial tuberosity. Collectively, they will all be supplied by the femoral nerve, and they will extend the knee. So those are the muscles of the anterior compartment. Muscles that will flex the hip, psoas major and iliacus or iliopsoas muscle, sartorius and pectineus. And then the muscles that will extend the knee are the quadriceps muscles with their conjoint attachment. The medial compartment muscles are the muscles that will cause adduction of the hip joint. They'll only affect the hip joint, and they can mainly do adduction with some exceptions. So certain muscles will affect the knee, certain muscles will do other jobs or other movements on the hip joints, like obturator externus. Obturator externus sometimes is considered a gluteal muscle because it does help with lateral rotation, but because it's supplied by the obturator nerve, it's considered as a medial compartment muscle. So these muscles are gracilis, adductor longus, brevis, and magnus, but the adductor part, and obturator externus. Let's start by looking at the gracilis muscle. The gracilis muscle is coming from the inferior pubic ramus and the ischial ramus or the ischial ramus, and as previously mentioned, it will insert behind the sartorius muscle. So it's part of pes anserinus. So you can expect it to also flex the knee joint. So again, gracilis muscle is coming from the inferior pubic ramus and the ischial ramus. It will insert into the anterior tibia, just a bit medial to the tibial tuberosity. So on the medial surface of the tibia behind the sartorius muscle. It is supplied by the obturator nerve, and so it does do adduction, but because its insertion is behind sartorius, so it's a pes anserinus muscle, it also helps in flexion of the knee joint. So this is the first muscle, the gracilis muscle. The second muscle is adductor longus. Adductor longus is forming the medial, or it's part of the medial border of the femoral triangle, and it is coming from the external surface of the pubis, inserting into the linea aspera, so the line on the posterior aspect of the femur, supplied by the obturator nerve. It does do adduction of the hip joint, but it can also help in medial rotation. So while it is doing adduction, the main job of it is adduction, it can also medially rotate the hip joint. So that's adductor longus. Adductor brevis is coming from the body of the pubis and the inferior pubic ramus, and it will attach to the linea aspera, supplied by the obturator nerve and causes adduction of the thigh. So far we have gracilis, adductor longus, and adductor brevis. Most of them are attaching to the linea, inserting into the linea aspera and causing adduction, but gracilis can flex the knee, and adductor longus, as we said, it can do medial rotation of the hip joint. Adductor magnus is this big muscle that actually has two parts. It has a part that will be part of the adductor muscles or the medial compartment, and another group or another part of it will be in the posterior compartment. The medial compartment is coming from, or both compartments are coming from the inferior pubic ramus and ischial ramus, which is the same origin as gracilis muscle. So inferior pubic ramus and ischial ramus is the origin of the gracilis muscle. From the external surface of the pubic, we have the adductor longus, and then inferior pubic ramus and the pubic body, we have the adductor brevis. And it's going to insert adductor magnus coming from the inferior pubic ramus and the ischial ramus. It's attaching into the linea aspera, supplied by the obturator nerve, and it's going to adduct the hip joint. So that is so far the muscles. We have one more muscle. As we said, this muscle can be technically considered a lateral rotator because it does do lateral rotation as seen in the video, but it can also do adduction. Obturator externus is coming from the external surface of the obturator foramen or the obturator membrane. The muscle coming from the internal will be the obturator internus, which is a gluteal muscle. This muscle does adduction. Obturator internus will do abduction. So they do opposite movements, but they both do lateral rotation. But obturator externus is medial compartment, but it does adduction. Obturator externus will do abduction. It's coming from the external surface and going into the trochanteric fossa, which is on the posterior aspect of the femur. We have intertrochanteric crest, and then we also have the trochanteric fossa. So it will insert into the trochanteric fossa of the femur. We have the muscles of the posterior compartment. These are the muscles situated between the posterior and the lateral intramuscular septa. They are a group of muscles that we'll collectively call as the hamstring muscle because they have a similar origin. They all roughly come from the ischial tuberosity. They are the muscles that are extending the hip joint and flexing the knee. It's biceps femoris, semitendinosus, semimembranosus, and adductor magnus, specifically the ischial part. Let's start with the biceps femoris. The biceps femoris muscle, similar to the biceps brachii, which is the muscle that we had in our arm. Biceps femoris has two heads. It has a long and a short head. The other muscle that we spoke having two heads had a straight and a reflected head that was rectus femoris, which is part of the quadriceps. Biceps femoris is part of the hamstrings. It has a long head coming from the ischial tuberosity and a short head coming from the distal linea aspera and from the lateral supracondylar ridge. The insertion will be in the head of the fibula, again, which is on the lateral aspect, and the lateral condyle of the tibia. It's important to remember it's on the lateral condyle because we have another muscle inserting into the medial condyle of the tibia. All of the posterior compartment muscles are supplied by the sciatic nerve, and all of them will cause extension of the hip and flexion of the knee. So again, it has two heads, a long head coming from the ischial tuberosity, and the short head that is coming from the distal linea aspera and the lateral supracondylar ridge of the femur, inserting into the head of the fibula and the lateral condyle of the tibia. The other muscle is semitendinosus. Semitendinosus was previously mentioned as a muscle inserting along with sartorius, part of the anterior compartment, gracilis, part of the medial compartment, and semitendinosus, which is the posterior compartment. Together were referred to as pes anserinus muscles. These muscles, we said, they help in flexion of the knee, or initiation of the flexion, or unlocking the knee. So this is something expected with semitendinosus, and it's a posterior compartment muscle. We expect it to extend the hip and flex the knee. Unlike when we spoke about gracilis and sartorius, it was an added thing. Here it is expected for the muscle to extend the hip and also flex the knee. The muscle is coming from the ischial tuberosity and inserting just posterior or just behind the attachment of the gracilis muscle. So on the medial to the tibial tuberosity on the proximal tibia, supplied by the sciatic nerve, and as mentioned, extension of the hip joint and flexion of the knee joint. The other muscle is semimembranosus, coming from the ischial tuberosity, inserting into the medial condyle of the tibia. So inserting onto the lateral condyle was the biceps femoris, inserting onto the medial condyle was the semimembranosus. Again, does extension of the hip joint and flexion of the knee joint. The last muscle we'll be covering is the adductor magnus, which we previously covered in the adductor or in the medial compartment. The only difference in these two, in the adductor compartment and in the ischial part, is their movement and their insertion, and obviously their nerve supply. So they both have the same origin. They're both coming from the inferior pubic ramus and the ischial ramus, as it is one muscle, but the part that is inserting to the linea aspera is the part that will adduct, supplied by the obturator nerve, and then the part that is inserted into the adductor tubercle, so a little bit more inferior, supplied by the sciatic nerve, is the part of the posterior compartment or the ischial part. This is the part, or this is the muscle that will extend the thigh at the hip joint and flex the leg at. Thank you so much for watching.